UnityPoint Health is committed to improving the health of the people in the communities it serves. We made an investment in Marshalltown and the surrounding communities when we entered the market in 2017. We know that a thriving local hospital is at the heart of a healthy community. I am so proud of our team for transforming the model of care to be more sustainable and to ensure that not only primary care thrives, but when seconds count in an emergency, that life-saving care remains available close to home.
I'm Sherry King. As the hospital administrator for UnityPoint Health Marshalltown, I am very excited for this next phase of life to begin here. In early September, my husband and I closed on a home here in Marshalltown, and we will be moved in fully in the next few weeks. We are really looking forward to getting to know our community and the area. We are also looking forward to having great local health care here in our own community, in a new, state-of-the-art, modern and efficient facility that promotes the health of this community. UnityPoint Health Marshalltown is adding 3 structures to our existing South Campus. The first is our hospital addition. This will be 65,000 square feet over 2 floors. This will house a 16-bed medical surgical unit, a 12-bed emergency department, and a 4-bed observation unit adjacent to the emergency department. Second is the clinic addition. This building will be 23,000 square feet at the northwest end of the existing campus, and it will house Marshalltown Family Medicine as well as our multi-specialty clinic. And finally, we are adding an emergency medical services building, roughly 5,000 square feet, that will house 5 of our ambulances as well as staff support space.
I think the community is going to be ecstatic when they see the new inpatient rooms. I think they're going to be thrilled with the aesthetics of the space. It's going to be up to date, beautiful, exactly the type of space that the patients and the families and people of Marshalltown deserve.
We look for that workflow to be streamlined. I think it's also fair to say when it's your loved one, you'd like to be in the room if you can, and about half of our rooms are just too small to accommodate any more than one person. And so we're really excited about just the utility of space and how that's going to improve the patient experience. I think we're going to be able to do our cutting-edge procedures at the bedside much easier, but I think patients will be more comfortable and will feel that not only in their experience, but in the experience that their families have when they come to the emergency room.
We're going to start worrying about the health of a community, not just the individual. We're going to add into that the community. And I'm so excited because this is the first hospital that in Iowa that's actually going to be designed and built conforming to that new type of strategy.
We want the best in healthcare services. We want it to be local. And I think a new hospital starts that for us. A new hospital is going to change the perception. I think the reality of that perception is going to allow us to recruit new doctors, new staff, bring in a whole new quality of care, and therefore our performance will match that perception. So I think it's an absolute critical first step to make Marshalltown the place we all want to live.
We need a quality hospital here in Marshalltown for a number of different reasons, and I can think of 2. Number 1, to keep people here using our hospital for their medical care and not going elsewhere for their medical needs and what they need. Secondly, we need a quality hospital for recruiting. We need to bring the employers need to bring in employees, and without a quality hospital, that becomes difficult.
It's no secret that we're in shortage of nurses and nurses' aides and techs. And so we want to attract not only to a place where they can have a career, have a profession, have a purpose, they can think about why they went into healthcare. And so I believe that providing this beautiful state-of-the-art space will really attract people.
We did our work. We got this project approved to build this new expanded facility in Marshalltown, but we need the community to use local healthcare so that we can continue to grow for the future of Marshalltown and our surrounding communities. The more people use local healthcare, the more services we can provide in the future.
I want to share a patient story with you. This story is an example of how important it is to have a local hospital here in Marshall County. It's a wonderful example of the need for local healthcare when minutes matter. I hope you're as touched by this story as I am. Here are Ken and Carolyn Anderson.
Well, it's Friday and I'm doing yard work and not feeling particularly good. I felt like indigestion and I think I'm having a gallbladder attack and we need to get to the hospital because this is really uncomfortable.
It was instant. I mean, it was 10 seconds in my mind that there was a crew of 5 or 8 people. Someone jumped on the gurney and was doing compressions as a nice lady came and got me. Ken was conscious at that time, although he has no memory of it. And the ER doctor said, "So who is his cardiologist?" And I said, "We thought this was a gallbladder thing. We have no cardiologist." When the doctor came out of surgery, he said not to expect him to make it through the night. Like 4 or 5 a.m., he opened his eyes for the first time. If we didn't have our local hospital here, Ken would not have survived.
It's going to take all of us to make it happen, and obviously the investment is beginning, but we as a community have to embrace that, and so we invite you to be part of this future.
We need everyone to get behind a great campaign like a new hospital. I mean, think about the day when we can step back and say, Marshalltown, Iowa has a brand new hospital. How many towns the size of Marshalltown are going to be able to say that, right? So it's going to take all of us, right? It always does. And I think I'd just ask everyone to think and say, how important is our healthcare system? How important is our medical services locally to us? And with that, engage, participate, and obviously financially support as you can.
I think having a great hospital matters because it's one of the best ways we can support our community.
And for a community that's 28,000 people to grow even larger, I just think that it says big things about where we want to go and what we want to do in this community.
As the largest employer with JBS, we have a responsibility to facilitate whatever we can do to grow Marshalltown and to provide the services like this project's going to. We would like to invite all of you to come help us sustain this project and financially support the long-term growth of Marshalltown and specifically the new endeavors with this hospital.
So I know something that is going to be critical to our success in this campaign is having all the support we can possible. I urge any and everybody whose ear we might have lent to us to go out and try to do your part to see if you might be able to assist in the betterment of our community.
I would invite people from all of the area around us where we serve our patients and our public to join me in this campaign. We need people involved so that it can be a success and we can bring quality medical care to all the people that we serve.
Very important to have a hospital in Marshalltown, especially Burmese people. We don't drive that much long, and we don't have to go to the mall. We don't have to go to another city. If we have a hospital in Marshalltown, it's going to be very great for our Burmese population.
This is going to impact so many people in the community, not only here right now. We can maybe think about this moment in time, who we are going to serve, but this is going to serve several generations to come. And I think that's what we need to keep in mind as my husband and I think about what financially we want to give towards this campaign. I hope that you'll join me in giving towards the future of healthcare in our community.
We are so excited about what the future holds for healthcare in this community. Thank you for letting us be a part of it.
Will you join my husband Rick and I in paying it forward, in leaving a legacy, in giving a gift for generations to come? Now is our time. It's our turn to give back to the community. Our community, our healthcare.
Our community, our healthcare.
Our community, our healthcare.
Our community, our healthcare.
Our community, our healthcare. Nuestra comunidad, nuestra salud.
Our community, our healthcare.
Our community, our healthcare. ကျွန်တော်တို့လူမှုကြီးအဖွဲ့အစည်းအတွက်ကျွန်တော်တို့ကျန်းမာရေးကုသရေးဆေးရုံ
Our community, our healthcare.
Our community, our healthcare.